go over some brief information about the services that are available through ODS. Since April went through the plan design changes for this year, and as far as other changes, they're rather limited, so my portion will be rather brief. In addition to the PowerPoint presentation, I have handouts which have pretty much the same information. Does everybody have a copy of this? Couple. There we go. Starting with the simple stuff, the medical plans as far as the networks go in this area, there's been no changes to the plan. So the provider network that was here last year hasn't seen any significant changes in the coming year. Something that we did add last year that some people are still not aware about is we added a travel benefit to the plan. So if you're traveling outside the ODS service area, there is a travel network that is Healthy Directions, and if you go to one of those providers, the benefits are paid at the in-network level. And then April talked a little bit about Plan 4. Currently, the closest providers for that would be providers in the Eugene area. If you do live closer to Eugene, that is something that would be available to you if the school district were to choose it. I don't know if they have intentions of doing that. So just to make you aware of that as well.
How do you access that travel network?
If you go to our website, it will list the network information, and then it will bring you to the PHCS provider network. That is just a travel network, so if you're seeking care, such as operations or something like that that need prior authorization, those still need to be done within the ODS service area, unless it's an emergency or urgent care situation.
Or if there's somewhere that I can access that in case I need to.
Yeah, exactly.
Gordon, is the phone number on the back of the ID card? I mean, if there's, so he's traveling, he's not going to have a computer necessarily with him. The travel information, the phone number to call ODS?
The ODS phone number is in there, and we could help with finding providers in that network if necessary. And this is just a graph showing the service area plan 4. We are adding to it significantly at this point in time, so it's possible that it might change, increase prior to open enrollment. And this is just the launch site for the ODS website, specific for OEB members, odscompanies.com/OEBB. And from that launch point, all the information is specific to OEB members. Once you're at the ODS website, you can access the My ODS system, which allows members to access their benefits specifically. It brings them to the network that they're on. And then from there, there's also links that refer them to formulary information. If you so desired, you can have your explanation of benefits that are currently paper-based. You can sign up electronically for those and receive email notifications when those are available. And then the system just archives those for you. We also have from there information regarding our health tools. EDOC is a system that allows members to email physicians questions, and then the provider gets back to you within 24 hours, usually less. And you can have an ongoing dialogue with that provider if there's follow-up questions to that, or they may forward your email to a specialist if it's something that's beyond their scope. If it's more emergent situation, there is a nurse line available to members. That's a 24-hour nurse line. Also, we have kind of 3 separate tools here: the treatment cost navigator, the prescription price check tool, and the dental optimizer. All 3 of those services are there for members to get average cost information on procedures that they might be looking into. And then it might provide information regarding alternatives to those procedures as well. And the WorldDoc, that's just the page that you access the information regarding your pharmacy. And it would allow you to check alternatives for brand name drugs, generics that might be available for those. Well, something that we are launching, and if you are making changes to your coverage in the fall time, you would be receiving new ID cards. They're light recyclable plastic material. It's just one side, front and back now, as opposed to the fold-out cards that we currently have. So the information on there is not as extensive as it was before, but it does provide the provider all the information that they need. But the bigger enhancement from our perspective on that is these cards are also available electronically. So on a smartphone, Android phone, iPhone, you could carry your ID card through that means. If the provider needs a copy of that card, you can just email it to them or fax it to them. So it kind of eliminates the need to carry that with you all the time. April talked a little bit about the incentive drugs. Similar to that, we have programs that our coaching staff work with members on. Working with the coaching staff is a free service. There's no co-pays or co-insurances that goes along for the coaching programs. And these are the programs. They've been in existence for quite a few years. The newer ones that are available is the spine and joint care. I think that's 1.5 years, 2 years old, as well as the dental care program. That's brand new. It just got launched about 3 months ago. So you can work with a nurse or a dental care provider regarding issues that you might have. Similar to that, we have our care management programs for people with more acute conditions. This helps members with discharge planning, as well as just kind of working through the healthcare system, making sure that members get the most benefit that's available to them through their plan. We have a new lower back pain project that we've been working with the state on. It's a cross-carrier program, and I think the closest providers for here for the back surgeries are probably in the Corvallis area. We have information on our website that links to participating providers in that program. It's really meant to get members into the health system as quickly as possible. So usually they get you in within 24 to 48 hours, as opposed to time periods that might be a little bit longer with programs or with providers not participating in the program. Plan 9, you said that you are currently using that. April really touched the highlights on that. The enhancements to it have been the fact that since April, we're adjudicating the claims at the point of service. So the system knows if you haven't met your deductible and you have to meet that. And then once your deductible has been met, then you're just responsible for the co-insurance portion. Prescription drug coverage. Nothing really new on this, just the fact that there are the 4 tiers, the value tiers with the low $4 copayment for specific medications, and then the corresponding tiers. A few months now, I forget how long, probably about 6 months, we did change to PPS as our mail order provider, as well as to Diplomat Pharmacy for specialty pharmaceuticals. And then on the value tier, these are the medications that are available at the $4 copayment amount. The ones to note, though, that are not available at the $4 copayment due to federal regulations on Plan 9 are depression and pain and arthritic medicines. You do have the vision plans with us, though, right? No? We're going to skip through a lot of stuff, though. Oop. Phone numbers. All the phone numbers are also available in the handouts as well. Any questions that I can answer for you right now?